Thank you again for joining us. As folks may know, my name is David Jordan. I'm the president and CEO of the United Methodist Health Ministry Fund. I appreciate you taking time to join us for today's webinar, which is focused on new public opinion research that explores Kansans' feelings and experiences around raising young children today. This includes opinions on programs designed to help children and families. The new study found that Kansans feel the economy is unfriendly to families and children raising young children, and largely, overwhelmingly, Kansans support programs that help families thrive. In fact, most families surveyed believe that the government is doing too little in Kansas to help families with young children. The study was conducted by PerryUndem, a nonpartisan research firm. The research was commissioned by the Health Fund and 4 other independent foundations that focus on improving the lives of children and families. And this was a multi-state study, which Mike will detail. As part of this research, we really wanted to gain deeper insight into families' current pain points and beliefs in order to help us understand how to better advocate to support families. Today's webinar will provide insights about programs that are necessary to better support families and help ensure economic security. Now, some quick housekeeping notes before we get started. Given the number of folks on the call, your lines are muted. However, we hope you use the chat function to engage throughout the webinar. If you could take a moment right now just to please introduce yourself into the chat, and please ask questions in the chat throughout the presentation. We will be monitoring the chat throughout the webinar, and we'll take questions after the presentation through the chat. We plan to monitor questions and really encourage you to ask questions. So just put in the chat if you have questions, and we'll get back to you. We're going to hold the discussion until after both presentations. To kick things off, we'd like to introduce our main presenter, Mike Perry. Mike is a partner and the co-founder of PerryUndem and led this research. After Mike presents, we'll hear from Lauren Fitzgerald, the managing director of the Kansas Common Sense Fund, who will provide some additional tools based on the research that may be helpful to help you better communicate the results of this survey. I'm really excited about this discussion, and I really am excited to partner with Mike and Lauren and both of their teams. So I'll turn things over to Mike and look forward to the robust discussion. Thanks, Mike.
Thank you, David. Hi, everybody. So I'm Mike Perry. I'm going to walk you through the research. I have my colleague Naomi here as well, and she may be answering your questions in the chat as we go along, but she also was a key partner on this project. Let me tell you about the study we did. Let's go to the next slide. So this study, yes, we asked general questions of the public about how they're doing these days, the economy, those kinds of questions, but we zeroed in pretty quickly in this study to focus on families raising young children. And so that was the frame in which we asked 3/4 of the questions in this research. Families with young children, how they're doing today, what kind of help and support do they need? The Health Fund and David's team, they were one of our partners in this. As David mentioned, this is kind of a unique study. It is 4 states. I'll go over those 4 states in a minute. One of them is Kansas, and it's also national in scope. Let's go to the next slide to tell you what we actually did. So the 4 states are Kansas, Montana, Nebraska, and New Hampshire. Those are the 4 states. We had funding partners in all those states. We did focus groups in those states. We did 8 focus groups with a mix of voters. We made sure there were always parents raising young children in those focus groups, but otherwise we mixed them by political ideology. We mixed them by part of the state. We wanted rural voices, we wanted suburban voices, we wanted urban voices. We did 2 focus groups with Kansas voters. We did 2 with Montana voters. We did 2 with Nebraska voters. We did 2 with New Hampshire voters. And then the last focus group we held was with early childhood educators, childcare providers, people who are sort of on the front line of these issues. And we had some Kansas providers in that focus group as well. That led us to a national survey. We had close to 2,000 voters in our survey. Again, it was national in scope, but we did some oversamples so that we could say things about states. We also did some oversamples of some key populations, which tend to be underrepresented in surveys. This was a summer study, so this is a very recent study. And we finished the survey in July, and now we're sharing the results with you. Let's go to the next slide. So there's 13 substantive slides here. It's not too many, but each of these slides, I have lots of things to say about each of these slides, but I'll try and move pretty quickly here. This first slide is not a surprise to you, which is Kansans are struggling with the economy, the cost of living right now. We had lots of different questions in our research that got at it. This is one of those questions. We asked them how concerned they are about each of the following right now. We asked about the cost of living. Nationally, we got 89% of voters saying they're concerned about the cost of living. That was 89% in Kansas as well. Cost of food and groceries, 87%, 85% in Kansas. Cost of healthcare, 85%, 90 Kansas. Cost of housing and rent, 76% total, 81% in Kansas. The possibility of an economic recession, 75% across both. So these are pretty high numbers. You have to keep in mind that it just wasn't middle income people in this survey. This was high income people, low income people, all over the income spectrum. And yet there is this kind of common worry and common concern around the economy, about the cost of living, around the cost of food. And these are not new. I've been picking up these high numbers for 3 years now. And that's what it gets to the next point, the quote on the page. In the Kansas focus group, we got the sense that there's a kind of fatigue setting in, that people have been struggling with these high cost of living for quite a while now. And there is a sense that they're not getting ahead. So they can get raises, their income can go up, they can get a new job, and yet they feel they can't get ahead. And here was a quote from a mom in our focus group who's in an urban area in Kansas. She said, even with getting raises and things like that, it's like the more money I make, the more things cost, the more daycare and camps things cost, the more food costs. So even though I'm making more money now than I've ever made, I don't really feel like I'm reaping the benefits. The cost of living is going up, and I just feel like I'm kind of in this complacent zone of kind of trying to feel optimistic, but at the same time, just kind of flatlining. So that was like the sentiment we heard in the Kansas focus groups, and we heard throughout the other states as well. Next slide. So here's where we zeroed in the research participants in on families raising young children. If you look at the question over the left side of the screen, it says, for the remainder of the survey, think about families with children age 5 or younger. That's sort of the frame that we wanted them to be in for this discussion. And then we asked them, how much, if at all, do you think families with young children are struggling with everyday costs right now? And nationally, we got 73% saying they think families with young children are struggling a lot right now. You got 24% saying some, hardly any saying like they're not struggling. In Kansas, it's slightly higher, 78% say families with young children are struggling right now. Again, we had lots of questions on this issue. And on every one of them, we got these really strong and high numbers that there's agreement that families with young children are struggling, that they need help right now. Over to the right is another important finding, which is we found that 69% of Kansas voters feel government is doing too little to support families with young children right now. So if there is a sense that families with young children are struggling, government seems to be falling down in its role to help families. We got 15% saying government doing too much, and then we got 16% saying government doing about the right amount. I'm going to stay here for a moment because I don't want you to think that government is the first place that Kansans go when you talk about help and what do families need to thrive, et cetera. They just kind of back-ended into this, that the problems are so big, they've been going on so long that families don't have the ability to solve them. Communities don't have the ability to solve cost of living, food prices, et cetera. Nonprofits, service providers, they don't have the capability of solving these problems. So they back-ended into the idea that only government can solve these big problems, and they feel they're doing too little right now to help families. Next slide. Childcare came up in lots of ways in the study, but in the most compelling ways, were in the focus groups. And that's because we had lots of parents who have been struggling to both find affordable quality childcare and also to pay for it. And to me, that was the most powerful part of the conversation. I'm sure all of you on the phone on this call understand the kinds of challenges families are facing around childcare, lots of discussions around the kinds of choices, hard choices that families are making. Does someone stay home? Is it worth it? Working part-time? Should they move? Even though they're living in an area where their family is and they're providing childcare, but it's not the home they want to be in, but they have to stay in that home. Those are the kinds of conversations we were hearing in these focus groups. We have two quotes here. The first is from a mom in suburban Kansas talking about working part-time. She's working part-time right now. She doesn't think it's worth it. It's not enough money to pay for childcare. She was contemplating quitting her part-time work, even though the family was struggling to afford their bills and was falling behind in bills, but it just wasn't worth it to keep working part-time anymore because the cost of childcare was another rent payment or mortgage payment. It was so high. The second quote has to do with just finding childcare to start with. So this is from a mom in a small town in Kansas. She said, I'm in a pretty small town. So we only have limited childcare and everything seems pretty full. And you got to wait so many months for kids to age out for you to try and get a spot. And it's not even a guarantee that you're going to get a spot or not. So they were seeing a shortage of workforce, a shortage of opportunities to find childcare. In the survey in Kansas, we got 60% of Kansas voters saying that they are concerned about the cost of childcare right now. That's a pretty high number, given that this wasn't just a poll of parents, this was a poll of everybody. So only a small portion of our poll are in that childcare phase. And yet it seems to be a known issue in Kansas and a known problem to get this high number. 60% of Kansas voters say they're concerned about the cost of childcare right now. Next slide. An important finding here, and this came out of the focus groups, because we got the feeling, and I'll get to this more in a minute, that they see government right now in Kansas and nationally as sort of getting in their way and not helping them. And there was this kind of consensus in the focus groups that government should be making it easier for families who are struggling to get help. They should not be putting barriers in their way. So we just put that statement in the poll and we got 86% of Kansas voters agreeing that government should make it easier. So the actual wording of the question was this: agree or disagree? We should make it easier for families raising young children to enroll in government programs when they need help, not put barriers in their way or make it harder. And so in Kansas, we got 86%, and nationally, we got 83% agreeing with this idea. Let's go to the next slide. I'll keep digging deeper into this theme. So this is very Kansas specific. They felt that it was hard to qualify for government assistance in Kansas. It was too hard. And why they felt that way was through lots of personal experience with it. And so we had people in the focus groups who talked about applying for SNAP or applying for Medicaid and being turned down, even though they only had one income, or even though they had lost a job or were behind in bills. They didn't feel they were doing well enough to meet their daily needs. And yet they were told by the state that they couldn't qualify for programs. Here are three of the kinds of comments we heard in the focus groups. Over to your left, this was a mom in suburban Kansas. She said, if someone needs SNAP benefits, you make $1 too much, and it's like, oh, well, but in reality, you're making $300 or $400 too little and to live and survive with the family. And that for me is why I will never have another child, not in this economy. My one is enough with what I have available. And I just want to point out, I can't tell you how many times we heard this kind of sentiment across the states. It came from women, young women, who either talked about not having children, putting off having children, or just having one child because of the cost of raising children. So people were very aware that they weren't able to make decisions about what kind of family they wanted because of this economy and because there was too little government help. The next quote over here says, sometimes they want you to be flat broke. And I think sometimes the only way to get assistance is they want you to be completely desperate with no money, and then they'll help. But at that point, it's still not enough to live. So these are the kinds of feelings around applying for assistance in Kansas. that it was a common experience to be turned away because the income thresholds were too low. Next slide. So this was an important slide. There's a lot here, and because I want to sort of explain what we did. In the focus groups and then also in the survey, we showed them a list of government programs that help children and help families. And we asked what they knew about the programs, their feelings about the programs, and if they felt we should increase funding for them, decrease funding for them, or keep funding at the same level. So we had a pretty big conversation around these programs. What we found, the big takeaway from this slide, is that they have a high favorability rating for all of these government programs. They like and support these government programs that help children and families, and that there was no energy. We only got 7%, for example, of Kansas voters supporting decreasing funding for Medicaid. We never got above 16% wanting to cut funding for any of these programs. But let me go through these programs. These are really high numbers, and I want to explain them to you. So this is the rank order that they came in terms of favorability. So the CHIP program, the Children's Health Insurance Program, we use the actual state names in the survey. We're just putting it Children's Health Insurance Program. And then we described it. The Children's Health Insurance Program for children in moderate income families, 89% have a favorable feeling about that program. In Kansas, is 93%. WIC, we gave a definition, 88% have a favorability, 90 in Kansas. Head Start, 87% favorable opinion, 93% in Kansas. You're noticing Kansas is always a little bit higher, which is interesting. Medicaid, 86% favorability, 92 in Kansas. TANF, 86%, 90, so forth as you go down. Child care subsidies, 82% support, have a favorability, 82% in Kansas. One reason why these numbers are so high, they would have been high regardless, but why they're in the almost 90 percentile, and sometimes they are in Kansas, is that number one, we define them. So one thing we learned in the focus group, we had to describe and define programs. We can't, yes, people have heard of WIC, but reminding them what WIC does and how it helps children and families, that was really important. That was the second important thing we did. We described how these programs help children specifically. So you'll look at Medicaid, for example. Medicaid, it is the largest funder of healthcare services for children, particularly early childhood screenings and treatments. We know Medicaid helps lots of different populations, but we wanted to focus on how Medicaid helps children and young families with that lens on it. And we got even more support than we normally do, and even more favorability. So a lesson here was always define these programs and always talk about how these programs help children and families. Next slide. We also found an appetite for states to do more. So we'll get to this at the end when we give advice. I know lots of people are in a defense mode. We're worried about cuts to Medicaid, worried about cuts to SNAP. And so we're in this kind of defense mode. And if we just stayed in that mode, I think we'd be missing opportunity, because this question got at new ideas and new policies and new ways to support families. And we found lots of support for them. So we talked about state paid leave family programs. 82% nationally said that they support this program. We didn't have enough Kansas voters to look at Kansas voters separately, but I'm sure it would have been high. Tax credits that would go to families to help them pay for childcare and other expenses that come with raising young children. 87% like tax credits for families to help pay for the cost of raising children. And then the last question, increasing wages for early childhood educators and childcare providers to attract more qualified people in the field, reduce turnover, and improve the quality of care children receive. 89% get behind that idea. Nationally, 95% in Kansas. This idea came out of the focus groups because there was a sense, number one, that the wages were too low in early childhood education, and number two, that that's part of the reason why there's a shortage, and that if we increase wages, we could attract more people to the field. So that's where that idea came from. Hugely popular in our survey. Next slide. It's not all happiness and sunshine when you talk about government programs in any state that I'm in right now, and any discussion I'm having, because there are concerns. there is a sense that there is too much waste and abuse in government programs. Too many people are getting benefits who shouldn't, who should be working, et cetera. Those feelings were apparent in our national survey. They also came up in our focus group of Kansans. So this is a real feeling out there that people have. We probably got even a higher number than we normally would have, because the last couple months, as Congress was debating that big, beautiful bill, they talked a lot about abuse and waste in programs. So this would have been very much front of mind for people. And so when we asked this question in the survey, we got a pretty high number. So we said, how concerned are you, if at all, about waste and abuse in government programs that support families and young children? And we got 75% nationally. We got 72% in Kansas saying that they are concerned. But, and here's sort of an important kind of insight. This is a new kind of question we haven't asked before, but it came out of the focus groups as well. There was a sense in our focus groups that some politicians exaggerate how much waste and abuse there are in programs and use it as a reason to build support for cuts to the programs. And so we asked that question. We got 75% of Kansas voters agreeing that some politicians exaggerate how much waste and abuse there is in government programs and use it as a reason to cut these programs. Next slide. So this is a big slide. So this is where the conversation went more national. And we asked them about that bill, the big bill in front of Congress. We had a whole bunch of questions about it. This is just one of those questions. One of the big findings here is that the majority of Kansas voters, 70%, they oppose cuts to Medicaid and SNAP that are part of that bill. 63 was a national number we got. When we look around at other polls, we don't do this polling in isolation. We look at what other pollsters are doing, and we look at what other surveys are finding. And generally, it's in the 60 percentile of the public seems to be leaning against this bill, thinking it's a bad idea. They're worried about the cuts. We found that true in Kansas as well, particularly when we told them how large these cuts were. I mean, these are huge cuts to Medicaid and SNAP. And when they saw the numbers, they leaned against it. They didn't think it was a good idea. They are also concerned about the potential negative impacts of this bill, and particularly on Kansas. So number one, their top worry is that this bill could lead to some hospitals shutting down, particularly in rural areas. 84% nationally worried about that. In Kansas, is 86. Children losing healthcare coverage, 83% nationally, 84%. More families with young children experiencing hunger and food insecurity. Their own healthcare costs going up is a worry. Fewer parents being able to afford quality childcare because now they've lost access to healthcare. They've lost access to affordable, healthy foods, so they might not be able to afford quality childcare. New mothers and infants experiencing more health problems as a result of a cutback on home visiting programs, school meal programs being cut. And then the last one's an interesting one. We got 71% nationally, 76% in Kansas saying they would be concerned if the paperwork burden for low-income parents rises and it gets harder to keep themselves and their children enrolled in programs. So that is speaking to those paperwork and work requirements that are part of that bill. They would be worried if that became so burdensome that families lost access to programs. Here's a quote. We got lots of quotes around this bill and what people understand about this bill. This person said, I feel like you're barely making ends meet and you just need that little bit of help still. And they're trying to rip that away from you when you're barely just making it. And that idea of like ripping away support was something that came up in the focus groups pretty strongly, particularly in this economy. Next slide. So I'm getting to messengers here. I just gave you some of the highlights. You need to know all these slides are going to be available for you. And they'll talk about that afterwards. So don't worry that you missed any of the details. When it comes to messengers, many of you who are on this webinar are the best messengers. So parents raising young children, but also preschool teachers and others involved in early education. If you look at the Kansas number, that's 58%. That's the highest one we get as being good messengers around this issue. Pediatricians, early childhood educators, childcare providers, social workers, teachers, child nutrition experts, working adults or parents of a child enrolled in Medicaid or CHIP. These are the best voices, not politicians, not outsiders, but people who are on the front lines serving families. That's who people want to hear from about what is happening with these programs, about the cuts, about what families need. So let's move on to some of the insights we have from this research we've done. So we want you to have confidence because there's lots of common ground here. I didn't really hit too many of hit that point too hard in the slides, but it was a fact that lots of the questions we asked, there was bipartisanship in the results. And so there's lots of places of common ground. For example, that families are struggling. There's common ground there, that families need more help, common ground there, that government should be making it easier, not harder for families, lots of common ground there. So there's lots of commonality here. You should feel confident when you go out and talk about families and children and what they need, and even about government programs, that there's lots of common ground here. This is a kind of shared interest in helping families and children thrive right now, and it's almost a relief to be in this space versus other issues that are much more divisive right now. This is the place of common ground. So have some confidence that there's going to be lots of people behind you when you speak about these issues. You don't need to talk very long about how hard life is for families right now. They get it, they understand it, and they are already at the place of knowing government needs to be doing more, not less, to help these families. You don't need to convince anybody of that. They feel like in Kansas that the state is making it hard for families to get the help that they need right now. So that is a uniquely Kansas point that you should push, and they want states to do more. Don't just be in defense mode. They support investing more in programs that help children and families thrive. So paid family leave, tax credits. They want new ideas, and they want to hear new ideas from you about how to help families during these hard times. There are concerns about government programs. The key here is they don't stop people from also wanting to expand access to programs. You can hold both things. You can be worried about abuse and fraud in programs and want the programs to do more to reduce it, but you can also be that same person who wants to expand access to programs because life is just too hard right now, and we need government to help families in need. So both can coexist. So don't be afraid when that comes up. And then know that there's lots of anxiety around this bill. Republican voters know the least about it. They haven't heard as much about Medicaid cuts, about SNAP cuts. It's important to reach those audiences with information around this bill and what these cuts could mean for families. Next slide. Things to consider: lean on trusted messengers. I mentioned who they were. Elevate their voices, use their lived experiences. That was the best part of this research in my mind, was hearing all the storytelling just happening impromptu in the focus groups. That was the most powerful part of that. Rely on that. Those are the best messengers. Focus on shared values. We found that there's agreement that family need more choices. They don't have choices in where they live, how many children they have, if a parent stays home or works, etc. And there was agreement that families need more choices, they need more autonomy, they need more flexibility, and you should tap those values. Don't be afraid about talking about the state doing more. They want that conversation. Anticipate concerns about waste and abuse. We just let it flow in the focus groups. It was important, but we just didn't let ourselves get bogged down there because we knew that people still wanted more access to these programs. So let it come up. You also want there to be less abuse and waste in these programs. You're not afraid of that conversation, but don't let it absorb the whole conversation. You can get stuck there. So be ready to transition out of it, saying things like children shouldn't pay the price, i.e. bringing it back to children. Talking about most families using the programs are already working. These are working families that we're talking about, and that we should be doing everything possible to help working families right now, which is agreement on. So go back to those points of agreement. And then also, lastly, point out the harms of new ideas like work requirements. Children are often missing from that conversation, how these barriers will impact children. Recall the survey found most Kansas voters, they want to make it easier for families, not harder. They don't want barriers in their way, and that's exactly what these new requirements are. They're burdensome paperwork rules. It is going to make it harder for families to stay enrolled. When parents lose coverage, their children often do too, and voters don't want that. Last slide. I'm not going to spend time here. You can see this when you can access the deck. These are some of the statements we had uh, in the focus groups. Interesting point here is we didn't really create these statements. We pulled them from what a number of elected officials were saying who were concerned about the big, beautiful bill. At that time, we just used their exact quotes. We also used quotes and ideas from the focus groups, and those were the statements that we tested to see if they resonated or not. The top ones were the ones that resonated the most. So, for example, saying working parents raising young children these days need choices and different types of supports, that was really powerful. The middle, saying we should be doing everything possible to aid working families to make their healthcare more affordable, to make it easier to get healthy foods and to find quality childcare so they can work. That also was the most powerful statement. So I'll end there because you're going to get much more advice on messaging coming up. And I hand it off.
Excellent. Thank you so much, Mike. I think there's a lot of great stuff there, and I hope folks will put some questions for Mike in the chat. And as you do that, I'll turn things over to Lauren Fitzgerald, who's the managing director at the Kansas Common Sense Fund, who's reviewed the messaging research and is creating some tools to share with the field. So, Lauren.
Thanks, David. Hi, everyone. I'm with the Kansas Common Sense Fund, and we are a communications hub essentially that serves like-minded nonprofit groups like yours. So what that means is we help organizations with many communication needs, such as messaging, talking points, strategic planning, website development, and much more. But for today, we put together a toolkit that you will receive after this briefing. And it's based on this research, but we've condensed it down into a few pages. And it will include the takeaways, it will include messaging guidance and talking points. And we've also got some social media copy and a lot of graphics for you all to use as you see fit. So let me know if you have any questions, and keep an eye out for the toolkit in your inbox in the next day or so.
Great. Thanks, Lauren. As we think about some of the messaging advice, I think it's helpful. And if folks have questions, again, please put them in the chat. Mike, you had highlighted that early childhood providers are really effective spokespeople. Can you talk a little bit about the reactions that folks had in sort of how they held early childhood providers in esteem, and also any insights into the focus groups that you held with early childhood providers about what they were thinking about these issues?
Yeah, great question, David. So we learned a lot from that focus group we did with early childhood educators and providers. We couple things. One is they have huge empathy for families in terms of costs. We found lots of these providers were working hand in hand with families to try and make it more affordable, giving discounts where they could, helping them fill out paperwork to apply for scholarship programs that states offer, et cetera. So they were like actively engaged and advocates for these families to gain access to childcare, but they also agreed around workforce shortage issues also being a big challenge, and also challenges with the state not doing enough to help families afford childcare. So those were some of the big takeaways from the providers. I think from the voters and the families in our study, there was just lots of empathy. They know it's really hard work. They seemed really aware that wages were too low, and that people in this field often couldn't afford health coverage for themselves, et cetera, were themselves enrolled in Medicaid or SNAP. And they didn't think that was right. And I think that's why we got such high numbers of people supporting the state helping to raise wages of early childhood educators and providers. So lots of empathy, lots of support for them. And yeah, they seem to be working together, honestly. That was what I was struck by. They seem to be working together to make it more affordable and accessible. Naomi, do you have something
Yeah, I
to
was
say?
just gonna piggyback onto what you said in terms of like what we heard in the focus groups when it came to the childcare providers as well, was, people really saw them as like experts in the field. They are the people on the ground. They have the most, real life experiences of what is happening in the childcare world. And so I think parents and families and just the Kansas voters that we had in the focus groups are really looking to them for guidance and information as like a reliable source of information about what is really happening in the work that they're doing every day.
I think that's really just important to pull out because I know that both in some of the focus groups, we heard some frustration from providers that they weren't really getting the respect they deserve. And I think that's 100% true. And we saw some similar feedback in a survey that we did. But I think it's just really important for the providers on this call to know that policymakers and the public want to hear from you. And this is really an opportunity for you to establish the credibility that you deserve on these issues. So you really can be powerful contributors to this debate. And I know the advocates on this call would benefit and are working to organize you. And so I think if you have questions about how to message or need tips, we want to hear from you because I think your stories can really resonate. And Lauren and the other advocates can really help you feel more confident in sharing your story. So I was really glad to see that research come out. Any other questions folks have? I've got several questions, so I can just keep going through, but if folks have questions, please put them in the chat. Mike, you had really highlighted that folks they have high trust in programs and don't want funding cut. For instance, just 7% of Kansans want Medicaid cut. And at the same time, our state policymakers, our speakers talking about deep cuts to Medicaid beyond what's going to be cut from at the federal level. Do you have advice from a messaging standpoint to really on how to best lift up the disconnect there between what some policymakers are talking about and really where the public is in Kansas on cuts?
Yeah, there's just no energy for cut. And by the way, that is not like a new finding. This is a finding that's been there for a while. With life so hard, prices so high, I mean, who would be in favor of cutting these kind of basic needs programs? It just anyone who sort of talks to anyone at the grocery store, et cetera, knows that like that's not the direction that people want to go. So there is a huge disconnect. Elected officials in Kansas and in Washington, a number of them seem to be out of sync with where voters are on this issue. I think I think you just need to keep hammering that there is no support. I think when the public sort of sees, you need to hold up a mirror to the public that you're in the majority when you're pushing against these cuts. Like, I don't know that the public knows and that's what you have to say. You have to sort of remind them that you were with the majority when you were opposing cuts to these programs. And I don't think, particularly given the debate we just had in Washington and all this cutting, looking for fraud and abuse in programs and the kind of narrative around abuse in programs, they could feel that, well, maybe that's what most people want. And so I think it's really important to sort of fight that feeling and sort of point out that this is not a popular idea, that only a small 7%, I mean, that is like almost nobody wants to cut these programs in the state of Kansas. So I think just keep on hammering that home, keep on making it hard for politicians to have that position. By the way, David, they often might not be calling it cuts. I mean, David and I worked for a long time. They call them other things. These are administrative changes to the program, et cetera, to make sure only qualified folks. They don't call it cuts, but we have to call them cuts because that's what they are. That's what they end up being. So we keep saying these are cuts and we keep hammering it home. Great, Lauren. Good question. There's lots of agreement on this. And even though we framed these programs around children, the last couple of months, I haven't been framing them around children. I've been sort of talking more broadly about Medicaid, for example, and there is not energy to cut the Medicaid program from anybody. I mean, it pays for nursing home care. It's so sort of key. And hospitals, the connection to hospitals, as David knows, it's always been a powerful argument to talk about Medicaid's role in funding hospitals. So even when we broaden the conversation beyond children and we're talking to people who are not parents right now, there's a strong sort of pushing back against cuts to Medicaid.
I think that's really an important reminder. You just referenced this, and and I wanted to tie a few things together and get your reaction. You talked about folks do want to have the conversation across party lines about waste, fraud, and abuse, and also at the same time in a discussion on who's deserving of services. But at the same time, in the focus groups and in the research, there's support for expanding access to services, and that folks shouldn't have as much of a challenge dealing with red tape, dealing with paperwork, dealing with bureaucracy. What's your advice to take on the issue of waste, fraud, and abuse? And why is it so important just to be confident that you can do it and win?
That's great. I mean, I think there's some politicians who think it's an either or, right? Like, so it's like we need to tackle waste and abuse in programs, and that means cuts. And when they do that, they're missing the other side of this, which is the stronger side of it, which is we need more access to these programs. We don't want to put barriers in the way of people. So they're sort of choosing to ignore the second half of that conversation and just focusing on the waste and abuse. So I think we keep telling the story of the second half of that conversation, because where we ended up in the focus groups is sort of telling like what a real conversation looks like around a full conversation around waste and abuse in programs. Where it ends up is, yes, as David said, we can agree that we need to keep working on this. And by the way, these programs have been working on this problem and have been reducing waste and abuse in these programs, and they need to keep doing it, and we are behind that. But I think it's the second part of the conversation that we need to now hit harder, which is where the Kansas voters ended up, which is we still need more help right now. Families are struggling. Government should be doing more. We shouldn't put barriers in the way. And that was a stronger sentiment that can win out. So I think you don't be afraid of the conversation on waste and abuse, but then you move to the second part of the conversation. But we still need more access to these programs. That's what I would suggest.
I think that's really helpful and just really so critical that folks should be confident in this messaging, because the public is with you. Mike, you talked about this at the beginning, and I think we saw it in the focus groups and the research, and even beyond this particular project, is that there's really since there's such a siloed information environment, that we should be thinking about opportunities to educate folks outside of our networks. Can you comment a little bit more on that and offer any advice on how to and why it's important to reach folks that may not be getting the news in the same way that we are?
Great question, David. So we did do some digging into all the questions we asked around that big budget bill in Congress and what people knew about it, their feelings about it, their worries about it, et cetera. I think the thing, and I mentioned it earlier, but I'll just double down on it, that I noticed is when we asked about awareness of cuts to Medicaid and when we asked about awareness to cuts to SNAP, that is where like a partisan divide happened. And Republican voters were much less likely to have heard about cuts to Medicaid and cuts to SNAP. But if you're a Democrat, if you're an independent, you are much more likely to know about that. If you were a more conservative person, a Republican voter, you knew more about cutting waste and abuse from programs, but you didn't know cutting Medicaid and SNAP. So I think the thing that we sort of learned from that is maybe in the more conservative media sources that Republicans are listening to, that part of the conversation wasn't covered in the same kind of way. And so I think that gets to David's point is you should be on conservative radio, you should be on conservative media, because that is a population who doesn't know as much about this bill. They don't know about cuts to Medicaid or SNAP. And they're not hearing that part of it. So I think that sort of is the missing piece for that. I will also say this, and we are a nonpartisan firm, so we weren't looking for sort of political divides, and I'm sort of challenging my earlier point. There's tons of common ground in this poll. But when we looked at who was conflicted about this bill, it wasn't Democrats and it wasn't independents. They had this clarity that they did not like this bill. They did not like these cuts to Medicaid and SNAP. And they were sort of far over on the spectrum of opposition. Who was in the middle was Republican voters. So Republican voters either somewhat opposed or somewhat supported. That's where the majority of Republican voters. So even sort of the base of the Republican Party was conflicted about this bill, by midsummer. And so I think that also is a opportunity for you to sort of engage this group who may not know as much about what's coming down their way in terms of Medicaid cuts and SNAP cuts, and who is most sort of at play at sort of wanting to learn about this and making a decision about it.
I think that's really helpful as folks are going out and organizing meetings across the state to talk about the impacts of the bill and thinking ahead to legislative session. Again, folks, if there's any other questions, please put them in the chat. I did have one more question. You talked about, and if Lauren, you have a follow-on to Mike, please jump in after. You talked about choice being an important driver in the discussion, and I think choices had power in some past constitutional, the concept of choice has been really powerful. Can you talk about how folks can include choice in messaging and talk about how policymakers are taking choices away from families by making some of the decisions they are? We saw an example in one of the quotes about the decisions the policies are making by making it tougher to get SNAP and Medicaid and TANF is making it tougher for families to thrive in Kansas. So I don't know if you could talk about that and offer some advice to advocates.
Sure. So the way that, we had a sense that value would be really important, but the way it came out was in the negative version, which is families don't have choices right now. And that's how it kept coming up in the focus group. They don't have choices it particularly came up on where they live, if one parent works or not, or stays home, how many children they have. Those are and even choice in job, changing job, etc. They just felt choice. This economy had taken away choice, and the fact that the state doesn't have lots of supports for them also was taking away choice. So it was the absence is how it sort of screamed its presence to us, like in this research, that they don't have choice now, and they think choice is essential for families to thrive. Families know best what their children need to do well in life, and they don't have the ability to make those decisions right now. The economy is driving it. Government sort of putting barriers in the way is driving it. And so that's how it came up. It's the thing missing right now is choice, and families need it. They think it's a critical ingredient for thriving, and they want it. So I think that's the way it sort of emerged in our study. I think you should talk about it. I think you should name the kinds of choices families want to have right now that they're not having. Yeah, and it was very powerful in that it doesn't exist right now, and they want it to exist, and they think families do better when they have choice.
Excellent. Thanks. Lauren, I don't know if you have any thoughts on that in the context of Kansas or any other advice as you're reacting to Mike's comments.
No, I completely agree. I mean, families want to have ownership over what their families need. So we will certainly have a talking point on that in the memo too, to hone in on.
Excellent. Thanks, Lauren. Any other questions folks have? As we close things out, Mike or Lauren, I don't know if you have any final thoughts. I really appreciate the partnership and all of this research. I think it's really helpful, interesting, and offers really good guidance.
I guess a couple final thoughts, which is, I mean, as someone who does lots of public opinion, and I'm doing focus groups every week, and I'm talking to real families, none of this surprised me. Maybe it didn't surprise you either. And then at the same time, I'm struck by how recent policy making seems so far removed from what I'm hearing from families. We got to close that gap. We got to scream it. And just keep telling the stories about how hard life is right now and that we need more help. And so, number one, I wasn't surprised. I've been hearing this a lot in our work, and I was really sort of struck by that. And the second thing is, it's for all of you who are doing all the good work on this call, like, to just have faith that it's going to matter at some point when policymaking goes so far away from where the public is. It runs into trouble eventually. And I think it's the work that you're doing every day, you being a messenger, you engaging people around these issues, that's what sort of chips away at that big gap. So I think that'd be my last thought, is to encourage you to keep doing what you're doing. You are the best messengers, and yeah, and eventually it's gonna tell.
I think that's a great message. Lauren, anything that you had?
I was really encouraged by the research findings, and it gave me a little bit of hope to arm us before session comes up. And this is just a little practical thing. In our toolkit, we will send out a link for graphics that you all can use, but know that we will continually add to that shared drive. So what you see now, there will be more coming too as well. And please reach out if you have any questions on anything.
Excellent. Well, thank you to Mike and thank you to Lauren. Thanks to everyone for joining us. As I'm been reflecting on this research, I think it's really striking to me that there's such broad support for programs that help families thrive. In folks, there's near unanimous opposition to some of the cuts that are being discussed at the state level. One other thing that was clear, and I know that was mentioned, was which is going to be a big issue for us in Kansas, is that there's real opposition to shifting these costs to the state. So as we're thinking about cuts at Medicaid trickling down to rural communities, as we're thinking about cost shifts on SNAP and making it tougher for the state to access dollars and get the error rates down, the public's with us, and it's really critical now. We recognize it as a funder, but that we go out and talk with folks, educate them and engage them in the policy discussions so that policymakers are hearing from the folks closest to the ground and those most impacted. So I really hope that folks leave this webinar feeling more confident that folks are really with you on these issues, and that you can really help move the needle as we think about state policy makers making decisions as a result of what passed in Congress and is what they're planning for next session. So as a follow-up, please reach out to us with any questions at the Health Fund. We're happy to share information. We'll get follow-up materials out to you. If you have feedback for us on this research, let us know. But please be in touch, and thank you all for the work you're doing, and thank you to the presenters. And thank you to the team at the Health Fund, Nancy, Katie, Jackie, Jeff, and Jennifer for helping support putting this together. So we appreciate the partnership with PerryUndem and the Kansas Common Sense Fund and with all of you. So thank you so much. Have a great day.
Thank you.